Ask the Expert is in partnership with Bon Secours St. Francis.
When it comes to taking care of your health, the health of your ears may not be the first thing that springs to mind. The World Health Organization says hearing loss affects 360 million people worldwide, but it can be prevented. As part of our Ask the Expert series, I spoke with an ear, nose, and throat doctor about taking proper care of your ears.
Hearing and balance are the two main things that the ears provide. Dr. Andrew Heffernan, an ear, nose, and throat physician, says the best thing you can do to keep your ears healthy is to use protection around loud noises.
If their job is noisy, they may want to wear ear protection for that. Certainly, if they're hunting, wearing ear protection when they're using guns or firearms.
More than 1 billion people aged 12 to 35 are at risk of hearing loss due to recreational noise exposure. It's important to catch it early, but besides a hearing test at birth and sometimes in elementary school, your doctor likely will not check your hearing at routine checkups.
Once people are a little bit older, we really rely on the patient to have a complaint of hearing loss. And if you start to have an issue with it affecting your life negatively, then that's really the time that you should come in for a hearing test.
If you have ringing in your ears known as tinnitus, tell your doctor. Around 20% of people have this problem. It's not a disease, but Dr. Heffernan says it can be a symptom that something is wrong.
There's really no medications that are approved and known to be effective treatments for tinnitus. There are some vitamins that certain people try that they find somewhat helpful.
There are some signs of hearing loss.
Oftentimes it's family members who urge patients to go be seen because they're having to ask to repeat themselves often and they're having trouble hearing in noisy environments.
Another important thing when it comes to ear health, earwax. You should not stick cotton swabs in the ear canal to clean them.
So you can use them just at the opening of that ear canal.
Dr. Heffernan says the body makes earwax for a reason and it serves a purpose.
It has a function of having some antibacterial, anti-itch properties, and also helps whip water out of the ear to keep the ear dry. So some wax is a good thing.
If you are experiencing hearing loss or any other problem with your ear, the first step is to reach out to your primary care physician. They can then refer you to an ear, nose, and throat doctor if necessary. Taylor Murray, 7 News.